Hello and welcome back everyone, or if you're new here, welcome to my channel where I talk about topics related to mental health and where I strive to inform you about topics related to mental health. Now here today I will be doing a follow-up to my previous video called Overview of Schizophrenia. In today's video I will be talking about the diagnosis and treatments of schizophrenia. Diagnosis of schizophrenia involves ruling out other mental health disorders and determining that symptoms are not due to substance abuse, medication, or another medical condition. Determining a diagnosis of schizophrenia may include things such as physical exams. These may be done to help rule out other problems that could be causing symptoms and to check for any related complications. Tests and screenings. These may include tests that help rule out conditions with similar symptoms and screening for alcohol and drugs. The doctor may also request imaging studies such as an MRI or a CAT scan. Psychiatric evaluation. A doctor or mental health professional checks mental status by observing appearance and demeanor and asking about things such as thoughts, moods, delusions, hallucinations, substance use, and the potential for violence or suicide. This also includes a discussion of family and your personal history. Diagnostic criteria for schizophrenia. A doctor or a mental health professional may use the criteria in the Diagnostic and Statistical Manual of Mental Disorders, also known as the DSM-5, which is published by the American Psychiatric Association. Now, in this section of the video, I will be talking about the treatments that are associated with schizophrenia. Schizophrenia requires lifelong treatment even when symptoms have subsided. Treatment with medications and psychosocial therapy can help manage the condition. In some cases, hospitalization may be needed. A psychiatrist experienced in treating schizophrenia usually guides the treatment. The treatment team may also include a psychologist, social worker, psychiatric nurse, and possibly a case manager to coordinate your care. The full team approach may be available in clinics with expertise in treating schizophrenia. Now in this segment, I will be talking about the medications that are used to treat schizophrenia. Medications are the cornerstone of schizophrenia treatment, and antipsychotic medications are the most commonly prescribed drugs. They're thought to control symptoms by affecting the brain neurotransmitter dopamine. The goal of treatment with antipsychotic medications is to effectively manage signs and symptoms at the lowest possible dose. The psychiatrist may try different drugs, different doses, or combinations over the time to achieve the desired result. Other medications may also help, such as antidepressants or anti-anxiety medications. It can take several weeks to notice an improvement in your symptoms. Because medications used to treat schizophrenia can cause serious side effects, people with schizophrenia may be reluctant to take them. Willingness to cooperate with treatment may affect drug choice. For example, someone who is resistant to taking medication on a consistent basis may need to be given injections instead of taking a pill. Ask your doctor about the benefits and the side effects of any medications that are prescribed. Now, I will be listing off second-generation antipsychotics used to treat schizophrenia. These newer second-generation antipsychotics are typically preferred because they pose a lower risk of serious side effects than do first-generation antipsychotics. Second-generation antipsychotics include the following: aripiprazole, also known as Abilify; acenapine, also known as Safras; brexpiprazole, also known as Rexulti; cariprazine, also known as Vraylar; clozapine, also known as Clozaril and Versacloz; iloperidone, also known as Fanapt; lorazepam, also known as Latuda; olanzapine, also known as Zyprexa; paliperidone, also known as Invega, quetiapine, also known as Seroquel, risperidone, also known as Risperdal, ziprasidone, also known as Geodon. Now I will be listing off first generation antipsychotics. These first generation antipsychotics have frequent and potentially significant neurological side effects, including the possibility of developing a movement disorder such as tardive dyskinesia that may have or may not be reversible. First generation antipsychotics include chlorpromazine, fluphenazine, haloperidol, and perfenazine. These antipsychotics are often cheaper than second generation antipsychotics, especially the generic versions, which can be an important consideration when long-term treatment is necessary. Now I will be talking about long-acting injectable antipsychotics. Some antipsychotics may be given as intramuscular or subcutaneous injections. They're usually given every 2 to 4 weeks depending on the medication. Ask your doctor about more information on injectable medications. This may be an option if someone has a preference for fewer pills and may help with adherence. Common medications that are available as an injection include aripiprazole, Abilify, Mantena, and Aristada, fluphenazine or decanoate, haloperidol, decanoate, paliperidone. Invega Sustenna is a monthly injection, and Invega Trinza is given as an injection every 3 months. Risperidone, Risperidol Consta, Perseris. Now I'll be talking about a form of treatment known as psychosocial intervention. Once psychosis recedes, in addition to continuing on medication, psychological and psychosocial interventions are important. These may include things such as individual therapy. Psychotherapy may help to normalize thought patterns. Also, learning to cope with stress and identify early warning signs of relapse can help people with schizophrenia manage their illness. Social skills training. This focuses on improving communication and social interactions and improving the ability to participate in daily activities. Family therapy. This provides support and education of families dealing with schizophrenia. Vocational rehabilitation and supported employment. This focuses on helping people with schizophrenia prepare for, find, and keep jobs. Most individuals with schizophrenia require some form of daily support. Many communities have programs to help people with schizophrenia with jobs, housing, self-help groups, and crisis situations. A case manager or someone on the treatment team can help find resources. With appropriate treatment, most people with schizophrenia can manage their illness. Now I'll be talking about instances when a person should be hospitalized. During crisis periods or times of severe symptoms, hospitalization may be necessary to ensure safety, proper nutrition, adequate sleep, and basic hygiene. Now I'll be talking about electroconvulsive therapy. For adults with schizophrenia who do not respond to drug therapy, electroconvulsive therapy, also known as ECT, may be considered. ECT may be helpful for someone who also has depression. Now in this segment of the video, I will be talking about coping and support for people and families of someone who has had a diagnosis of schizophrenia. Coping with a mental disorder as serious as schizophrenia can be challenging, both for the person with the disorder and for family and friends as well. Here are some ways to cope with the disorder. Learn about schizophrenia. Education about the disorder can help the person with schizophrenia understand the importance of sticking to the treatment plan. Education can help family and friends understand the disorder and be more compassionate with the person who has it. Stay focused on your goals. Managing schizophrenia is an ongoing process. Keeping treatment goals in mind can help the person with schizophrenia stay motivated. Help your loved one to remember to take responsibility for managing the disorder and working towards goals. Avoid alcohol and drug use. Using alcohol, nicotine, or recreational drugs can make it difficult to treat schizophrenia. If your loved one is addicted, quitting can be a real challenge. Get advice from the healthcare team on how to approach the issue. Ask about social service assistance. These services may be able to help with things such as affordable housing, transportation, and other daily activities. Learn relaxation and stress management. The person with schizophrenia and the loved ones of that person with the disorder may benefit from stress reduction techniques such as meditation, yoga, or Tai Chi. Join a support group. Support groups for people with schizophrenia can help them reach out to other people facing similar challenges. Support groups may also help family and friends cope. Next, I will be talking about things you can do to prepare for your appointment. If you are the person seeking help, or if you're seeking help for someone with schizophrenia, you may start by seeing your family doctor or healthcare professional. However, in some cases, when you call to schedule the appointment, you may be immediately referred to a psychiatrist. Now, here's a list of things you can do to prepare for your appointment. 1. Any symptoms that you or your loved one is experiencing, including any that may seem unrelated to the reason for the appointment. Key personal information, including any major stresses or changes that have been recent. Medications, vitamins, herbs, or other supplements that the individual may be taking, and include the dosages. Here I will be talking about questions that you can ask your doctor. But before I get into that, if you are seeking information for a loved one, go with them to the appointment. Getting the information firsthand will help you know what either you or they are facing and what you can do to help them. For schizophrenia, some basic questions to ask your doctor are as follows. What's likely causing the symptoms or the condition? What kind of tests are needed? Is this condition likely to be temporary or lifelong? What is the best treatment that you suggest? What are the alternatives to the primary treatment that you're suggesting? How can I be most helpful and supportive? Do you have any brochures or printed material that I can have? What websites do you recommend? Don't hesitate to ask your doctor any other questions that you may think of during your appointment. Now I will be talking about what you can expect from your doctor. The doctor is likely to ask you a number of questions. Anticipating some of these questions can help make the discussion more productive. These questions may include the following. What symptoms are you or your loved one experiencing, and when did you first notice them? Has anyone else in your family been diagnosed with schizophrenia? Have the symptoms that you are experiencing been continuous or occasional? Depending if the appointment is for your loved one, the doctor may ask if you or your loved one has talked about suicide. How well does the person with schizophrenia, whether it is yourself or a loved one, the doctor will ask how you or they function in daily life. Is he or she eating regularly? Are you or they going to school or work? And are they bathing regularly and practicing good hygiene? Have you or your loved one been diagnosed with any other medical conditions? What medications are you or your loved one currently taking? The doctor or mental health professional will ask additional questions based on responses, symptoms, and what needs you may have. I hope that this video has helped someone or has answered some questions that you may have as a viewer may have had, because that is what I try to do here on my channel, is give information on topics related to mental health. If this video has helped someone or has helped you, or you like what I do here at my channel, please like, comment, and subscribe. Because with every subscriber, this is how we build the community where we can discuss mental health and to shatter the stigma surrounding it. This has been Chris, mental health advocate, and until the next video, I'll catch you on the flip side.